Yeah, so I mean, we presented data from the first randomized trial of Trastuzumab deruxtecan, which is a new antibody drug conjugate that targets HER2. And we randomized this against standard therapy, chemotherapy for patients who have HER2 low metastatic breast cancer. This is an important study because it's the first big study that has shown targeting HER2, low levels of HER2, is more effective than standard therapy for this population of patients that has HER2 low metastatic breast cancer. So in this trial, we looked specifically at patients who had advanced stage HER2 low metastatic breast cancer, and we defined HER2 low as tumors with 1+ or 2+, no gene amplification. And this was the specific group we enrolled. These patients had to have had at least 1 or maximum 2 lines of chemotherapy in the metastatic setting. And the hormone positive patients additionally had to have gone through endocrine lines of therapy and be considered endocrine refractory. So it's a more advanced population. And the patients were randomized in a 2-to-1 fashion. Trastuzumab deruxtecan was given by the approved label. And in the chemotherapy arm of physician's choice, there was a number of options: capecitabine, eribulin, gemcitabine, Taxol or paclitaxel, nab-paclitaxel, which are among the most commonly used chemotherapies in this setting. And our goal, really, the primary endpoint of the trial was to look at progression-free survival in the hormone-positive HER2 low patients. And then if we saw a positive signal there, we would look at the PFS for the whole population of patients, and similarly then overall survival for the hormone positive, and then all patients on study. We enrolled, our plan was to enroll 540 patients, and we tried to balance out the subgroups, the hormone receptor subgroups, based on the natural prevalence we see in HER2 low breast cancer. So our goal was to enroll about 480 hormone positive and about 60 hormone receptor negative HER2 low patients. So in terms of our efficacy findings for the primary endpoint of PFS in the hormone receptor positive patients, so for the efficacy endpoints, starting with the PFS endpoints, for our primary analysis population in the hormone receptor positive patients, the hazard ratio for PFS was 0.51, and this was statistically significant with a p-value of less than 0.0001. And what that translated to was an improvement in median overall median progression-free survival of 5.4 months up to 10.1 months. Which is very significant for a late-stage setting in breast cancer. When we looked at the overall study population, we found very similar results. The PFS hazard ratio was nearly identical at 0.5, and very similar improvement in median PFS, approximately 5 months up to approximately 10 months. So it was really great to see that kind of gain in survival for these late-stage patients. One of the key secondary endpoints, of course, was overall survival. And again, we had statistically significant hazard ratio of 0.64, and we saw improvements in median survival from approximately 16 or 17 months up to almost 24 months. So again, really satisfying to see, gains in over 6 months in survival for this sort of refractory population of patients. We don't often achieve that in the late-stage metastatic setting. So lung toxicity is a known and important toxicity of T-DXd. We monitor for that, I think, closely, and in this trial we saw an incidence of 12%. The majority of the cases were low grade, so grades 1 and 2 and reversible, but we did have a few high-grade events. In total, there were 3 deaths from lung toxicity for an incidence of 0.8%. And I think it's just a reminder again that this is an important toxicity of this drug, and it really warrants vigilance and early intervention. Having said that, in spite of these ILD events, overall we're seeing a very impressive survival advantage from T-DXd, and so I think the risk-benefit is still towards this as being an important drug for patients. So I think there's 2 really important, points, takeaway messages from this research. The first is that, we have established for the first time a new subgroup of patients, which we call HER2 low, that have cancers that are targetable with a HER2 targeted agent, and we have really set, I think, trastuzumab deruxtecan as the standard of care for this population of patients. So, you know, some paradigm shifting, I think, discovery in this study. It's going to force us to rethink about the subgroups within HER2 negative breast cancer. And, you know, these data really have the potential to impact survival for about half of our patients with metastatic breast cancer.